Good afternoon, everyone. We'll be starting shortly. Please switch on your cameras and your mics on mute. I request all the participants to please switch on the camera.
Friends, we will begin in another 2 minutes. So it's a request for all the participants to please switch on your cameras and switch off your microphones. Thank you. Sir, shall we start?
Sure.
Yes, sir. Good afternoon to everyone present here. I would like to start today's event with a quote by Elizabeth Taylor. It is bad enough that people are dying of AIDS, but no one should die of ignorance. Once again, good afternoon, everyone. We welcome you to the lecture on ending the HIV/AIDS epidemic, awareness and prevention. Without further delay, let's begin. I request all my friends present here to please keep their microphones on mute and cameras on so that we can have a great learning experience together. Managers Without Borders is a company registered under Section 8 of Companies Act 2013, started by 3 individuals, which now has vast connections all over the country. It has become the youngest NGO in South Asia to reach the final eNGO Challenge South Asia Awards in 2015 for using internet tools to promote entrepreneurship. MWP is a Guinness World Record holder for the longest mobile chain. The mission of this chapter has always been to construct a dense network of students and professionals in the field of management.
Sankalp is the official leadership and nation building club of IFHE. It was founded with a view to inculcate social and leadership capabilities in the students. Sankalp aims to harness the potential towards the well being of the society. Over the years, our motto is to serve with pride, lead with confidence, and inspire to impact lives. Be the change. It functions on 3 pillars: corporate leadership, social leadership, and political leadership. Under corporate leadership, it prepares managers for becoming corporate leaders by organizing our major event, Magnet, and flagship event, Majestános. Under social leadership, it has numerous events which are directly or indirectly are for the welfare of society. The major ones are Drishti, Wishing Tree, and visits to old age homes, various schools in the locality. Under political leadership, Sankalp focuses on civic issues and public policies by organizing guest lectures from experts in specific fields.
Our today's guest of honor, Dr. Rakesh Bharti, is a consultant at Bharati Dharma Care and Research Center, Amritsar. His memberships include IMA, IAL, Indian Association of Sexology, Life Member and all. Mr. Rakesh Bharti was office bearer in IADVL Regional Chapter as Secretary and President. Designated HIV Specialist by American Academy of HIV Medicine. He won second prize in a recently held competition by IDWA at national level 2020. His publications include 30 in national and international journals. Some notable ones being on mesalazine in psoriasis, topiramate in dermatology, Leflosaxin in leprosy, and most recently, one of the best 10 papers of 2019 in JAAD on microneedling and 5FU in vitiligo, a new peer. He also authored 2 books, one on the subject of HIV and one on sexual dysfunction. These are just a few, and there are many more achieved by him.
Today, we have a golden opportunity to welcome our very own beloved faculty, Madhvi Garika Parthi ma'am, in between us. She is Associate Professor in the field of management. She is also Student Activity Coordinator of IBS Hyderabad. Her research interests involve areas of service quality, e-commerce, competitive strategies, CRM, brands, and consumers. Madhvi ma'am has 23 years of professional experience that she shares with us to help in our holistic growth. She has given her valuable knowledge and teachings in IBS Hyderabad and IBS Mumbai. We are lucky enough to read her intellectual thoughts through her research paper that has been published in the international journal Management Research and Business Strategy. We are honored to study marketing and management in the same era of her teachings as under her commendable knowledge. We would once again like to welcome you, sir, all the doctors and participants for joining us in taking a step forward in this initiative. Over to you, sir.
Thank you. I'm delighted. I'm delighted for many reasons. The virtual meeting has brought so many people in reality together. I'm delighted because my son and my daughter-in-law graduated, as I was telling earlier, to Kalyan and Muskan and Tanya from the same college. And nowadays they're working in Bahrain. So it's like a very pleasant evening for me. Good evening to everyone here. And let me begin with saying what Kalyan said, that let ignorance not kill. Now, my counter question is, does knowledge saves you? Let me give a simile. I hope somebody has not muted. Anyways, think about these days, Corona days. We always
Sir, you are
You're
on.
you're on mute. Hello. Hello, sir.
Oh, I was not audible?
No, sir, you were on mute.
Oh my God. So should I start again?
No, sir, just from last 2 to 3 sentences, that's all. Just for last 30 seconds.
Oh, okay. Okay. So I was telling that a few weeks ago, there was a marriage function in my family and everybody was present except me because I had to fly from Amritsar. And they kept on partying till 4 a.m. in the morning, and none of them was wearing a mask, although everybody knows that mask can save you from COVID, right? So knowledge was there, but what happened next was they were enjoying still. And this is not something which I'm telling you of my family. This I'm seeing every day in, day out. Now I go out, I see that people are not wearing masks. They are not scared of, although there is a knowledge that mask can protect you from corona. Now, what happened next was that one of them, the bride's father, had corona. So there was panic in the whole family after the event. And the people who were laughing at me that you missed a party, you can estimate what would have happened to them. Anyways, bringing it similarly to this, now everybody knows doing a protected sex, using a condom can prevent you from many things, but still people are knowledgeable, but still they do not want to follow it. So I don't know knowledge prevents it or not. It is the implementation of knowledge which probably prevents the diseases, which can save you from dying. I was just thinking this morning during the walk that this mask thing and the condom thing are probably similar. We know it should be used, but we don't. We know it should be used, but we don't use. So what is the point? The point is that you young guys, when you listen to all what I'm going to tell you now, you go and spread the message. If each one of you spread to at least one person that this is what can happen and this is how you can be saved, then I think the purpose of this meeting, which is organized by 2-3 different organizations, as I believe, Sankalp and Managers Without Borders. So I think then it will be a really successful meeting. Otherwise, it will remain virtual and no real fruit will come out of it. This is my take on it. And if you guys allow me, I want to share my screen for the time being. So coming to this, I want to say that this World AIDS Day, no, we have been celebrating it for n number of years. I don't want to go into that. That how many for many years now on World AIDS Day, I'm like a celebrity. Everybody is running after me. That this morning I had a talk on FM and I was in the newspapers, and now I'm talking to you guys. So it's lovely. But lovely for what? What is the target? The target is by 2030, we should eliminate AIDS. By 2020, we wanted that number should go down below 50,000, which has not happened. So what I want to say is that I will not go into numbers, that what numbers and what not numbers you should know. But you should know that we want to stop this. We don't want, even today, I am pained when I see, last week a patient called me and he's telling me, sir, I had some lesions on my genitalia. I said, okay, yeah, because I'm seeing online only, send me the pictures, and I did a video call and I realized that he had relations with a lady. Who lady? She was known to him. She was married. And he told me, I said, she's married. Now you can vouch for yourself. She can vouch for herself. But nobody can vouch for your wife and her husband. And if you really think it, the number of contacts you have can multiply geometrically, which you don't understand. I mean, on a single contact tracing, we call it contact tracing, one person having sex with one person. A single contact tracing can lead on to minimum 60 to 100 contacts. Just imagine a husband goes to another person and she goes to another person and her husband goes to another person. If you think seriously, it is a dangerous proposition. Usually people come to me and they will say, sir, well, she's my personal. What is that personal thing? There's nothing personal in it. The disease doesn't see that somebody, and the disease is not written on anybody's face. So don't think that just by looking at the face of a person and having relations with him or her can save you. If I show you, I'm seeing HIV patients since many years now. These are the photographs you see of various patients who have suffered. But before going into that, history always teaches us. History, what does it teach? It teaches us how to, prevent, how to make our future better. So if you look into these historical facts, I don't know, can you see the slides? Can somebody respond? Yes. Okay. So the first case in India was reported in 1986. Of course, I saw my first case in 1990. And believe you me, guys, the same stigma which is today attached to Corona was attached to HIV in those days. The person was in a room which was locked from outside, and he was given food by his wife from outside in a tray, like we give to COVID patients when we quarantine them at home these days. So what a similarity. And of course, fortunately, probably so many patients didn't die of HIV AIDS, but then I see many similarities between these two epidemics. Then the level rose among the high-risk groups. We started saying only the high-risk groups get it. That is the men having sex with men. I'll come to that how it spreads and all. But first I want to tell you that what is the history. In 1994, it spread to the general population. And then there was a rapid spread, at least in India, in 4 states, and 6 states has more than 1% population suffering from that. This is all history written here. I don't want to go into it, but what I can tell you is that how it spreads. I am reminded of one of my talks in a law faculty of a local university. When we went there, we made a group, AIDS awareness group. This was the first group made NGO in the Northern India for working on HIV AIDS. We went to deliver a talk in a law department, and I was surprised. None was ready to listen to us. I don't know, had this been a real meeting, how many of you would have been listening to me? Now you are forced to mute yourself. But in a real meeting, you are not forced to mute yourself. You can make noises. So when we went there, these law faculty students were very, very, they said, what are you going to tell us? We know that it spreads by sex. It spreads by unsafe syringes. It spreads by mother to child, by blood transfusion. What new you are going to tell? People were not ready to listen. Now, this is where, what Kalyan said, that ignorance. Your overconfidence that quite is a different story. Had this been a real meeting, I could have narrated. But, being a scientist, being a doctor, you have many things up your sleeves, which the commerce or a law graduate or a management graduate or a student may not know. So you can silence them. But the question is, people were not ready to listen. But modes, let me repeat, and what happened in that another meeting was very extraordinary. It was a gathering of about 600 people, a large auditorium. I was speaking like this. It was a pin drop silence because many people wanted to know things. But at the end of it, I said, if anybody has a question, please come and ask me. So in that 500-600, I was seeing this, that how many invitees, how many guests are listening to this. I saw more of girls than boys. But in that auditorium, that day, there were few girls and more of boys. And out of the whole lot, a girl stood up to me, and I'm talking of early 90s, let me tell you. I'm not talking of 2020. A girl stood up and said, Dr. Bharti, you know that oral sex is very prevalent in the university campus. Can this transmit HIV? For a moment, I was flabbergasted. I didn't know how. I was thinking that, look at the guts of this girl. But then I realized that it is the reality. What guts? She's saying the reality. So I have, in this slide, if you see, I have written sex. In my initial talks, I used to say that any sex which is unreligious. Now, when I say unreligious, it means which is beyond the bounds of the religion. Our religion binds us to certain things. Our religion mostly tells us to be monogamous. Even in Muslims, even if they can marry 4 partners, they cannot cheat on partners, right? Our religion doesn't tell us to cheat, I say. I don't know how rightly, in what perspective you will take this word. Which is unprotected, which is I'm back. There was some technical problem. Can you hear me?
Yes, sir. Yes, sir. We can hear you.
Hello. So till what did you hear last?
Sir, it was HIV you were telling us about the girl guts. Yes.
No, okay, I come back to any sex is unreligious. Can you get it now? Kalyan, can you hear me?
Yes, sir. We can hear you, sir.
So where was I when you heard me last?
Sir, you were talking about guts of a girl. You were telling us that.
Okay.
The girl
So I was
guts.
talking unnatural sex, right?
Yes, sir. Yes, sir.
Okay. So when I say unnatural, what is natural sex? Natural sex is to produce, to propagate the progeny, right? Whatever is not included into that. Many people come to. Am I audible now, Kalyan? No.
Sir, you're audible, sir, but there is a lot of disturbance from your side.
Let me do something. Can you give me a minute? Break?
Yes, sir. Sure, sir. Sure.
Try to connect it with another network. Will that do?
Yes, sir. Yes, sir.
So, can you hear me?
So we can hear you, sir. We can hear you, but there is a
Is it
little.
okay? Is it better now?
It is okay, sir. It is just okay. Like again, there is that disturbance still exists.
Oh my goodness. Then I really can't help. Anyways, let me try to say whatever. Hana?
Yes,
So
sir.
I was
Sure.
saying any sex which is unnatural, unreligious, unprotected. Now, what is unnatural is which is not to produce a child, like the oral sex. Many of my friends, when they went to Bangkok, they came back and they said, I vividly remember even the top-notch specialists of the town, I went to their massage parlors. One of them told me, went to a massage parlor. My wife was with me. That was surprising. And the girl was massaging, giving me a massage, and then she did a oral sex in presence of his wife. And then he was in tears. He went mad till his HIV report came negative. Many a times in my city, I don't know about Hyderabad or other cities, but I know in my city, there are many massage parlors and where this thing is very, very, very common. So don't go away with the idea that it is only a unprotected vaginal sex which will. As a matter of fact, if you ask me, men having sex with men, the anal route is the worst route to get the transmission of the HIV. Kalyan, is it better now?
Yes,
Okay,
sir. It is good.
okay. So it is important to know how it spreads. That is unnatural, unprotected, unreligious sex is one way. But when I say this, you should also remember how it will not spread. How it will not spread? I always used to give one example of, you can see here the Richard um, um, kissing this famous film actress. If you give a peck on the cheek, it will not spread the virus. It is only a deep French kiss which can lead on to the transmission of the virus. And don't go away with the idea that the kisses cannot. They can also. So when you know that how it spreads, now besides sex, what is important is, are you seeing the screen also or no? You're not seeing. Anyways, doesn't matter. It is also important that blood transfusion, I always say safe transfusion is important. We have become such a cheat country that we want to make money on anything, even a transfusion needle, which costs hardly anything. If we reuse it, God forbid, if you fall sick and you require blood, make sure. Blood is one thing nobody wants to donate. I don't know why. We as doctors used to say, if one patient is surrounded by so many attendants, just go there and tell them we want blood, everybody will run away. I mean, this is ridiculous. But make sure if there is an emergency, then blood is required, then one should donate who is healthy. And it should be tested, and it should be amongst you, your family, your friends. Why not? The other thing, if you fall ill, you go to a doctor, he tells you to get yourself tested. You go to a laboratory, even if it is one of the best laboratories, don't believe them. Why I am saying so? You go to the best of the hotels and you visit the kitchen and you will see it is not, everything is not good. So what is the point? Same way, if you go for a blood testing, or if you go for some injection treatment for your treatment purposes, make sure that the syringes are safe. Safe sex, safe blood transfusion. And the most important thing, as I see in today's gathering, there are more girls. It is important to have a safe motherhood. You know, at the time of delivery, when you are going to a gynecologist, there are instruments being used. When I talk about instruments, think about a dental surgeon, think about an orthopedician, think about many specialties of my field where instruments are used. Make sure it is your right that sterilized things are used for this. So safe motherhood, safe syringes, safe sex is important. And similarly, if there is a patient there is a person, there is a lady who is HIV positive, then make sure that delivery is done in a way so that the child, when it is born, is HIV negative. And this is possible now, we can give medicines for that. So main routes of transmission are three only. One is sex, number two is blood, wherever blood comes out. It can be a tattoo, it can be ear piercing, it can be going to a barber. Anything where blood can come out can lead on to the transmission of not only HIV, but many diseases like hepatitis C, hepatitis B, all are equally dangerous. But HIV definitely is more, I will not say it is not a question of life and death now, as far as HIV is concerned. But when I say this, don't go away with the idea, no worries, Dr. Bharti is there. If we get it, he will treat us. Don't go with that idea. Of course, it is treatable. It is manageable. It is like any chronic disease like diabetes or hypertension that you keep taking one pill every day throughout the life and you will be safe. But that doesn't mean you should have it, even at the risk of this. It is like this, कि mask nahi pehenenge to kya hoga? What is there? At most we will have corona. You may survive. So what? Even if you survive, there can be sequelae. In HIV, the sequelae will be bad. There will be questions of marrying, there will be questions of getting a child, there will be questions of how to cope up with the medicines, the cost. Even if the government is giving free, at least one has to go to the government center and get the medicine. There are many things about that. So you have to be careful about that. So sex, blood, and third way is mother to child. If a mother is HIV positive, she can transmit the virus during the delivery, before the delivery, after the delivery, and even after when she is feeding the child on breast milk. So these are the possibilities. When these situations occur, then a HIV positive mother must consult a doctor. He can or she can ensure that the child born to a HIV positive mother is negative, remains negative. They are now possible with the help of the advancement in the science. So that is the advantage of this science. Then there are issues about the HIV testing. You know, I remember whenever you ask for a HIV testing, these days people may not bother that much, but in earlier days, you know, they go to the laboratory and laboratory wala will say you are HIV positive. I have seen few lives being lost. Before coming back with the test report, they committed suicide. Because the laboratory guys are not that educated. They don't know how to break the news or whether how to interpret the test. Sometimes what can happen is there can be false reports. You all must be listening these days about these corona reports that so-and-so was found COVID negative, but later on he succumbed and it was found that he was positive later on the different tests. What is that? these are the fallacies of the test. So even if you indulge into something, yes, Kalyan, okay, is that okay?
Yes, sir. Yes, sir. We can hear
Okay,
you.
okay. So I'm audible. Okay. So even if somebody asks you for a test for whatever, these days, even for a small surgery, the doctors ask for a HIV test. And if by any chance, and you go for a blood donation, they test you. So if by any chance that happens, do not panic. Do not panic. Go to the doctor. There are confirmatory tests, and tests have their fallacies, though you must not take your own decisions. In next few minutes, I will show you some slides of patients. No, I am not sharing the screen, I believe, right? Or I'm sharing. Should I? Should I try now?
Yes, sir. Yes, sir. You can.
Okay. So these are the slides I'm showing you. You can see that this is how the patients present. This is a newly wed lady who came with a small little thing on the neck, and she was having syphilis, a disease we have forgotten. Now, through sex, it is not HIV which is transmitted. Through sex, there are minimum 100 diseases which can be transmitted from one person to the other. So once you have an unprotected sex, once you have a one-night stand, which can occur, I really do not blame anyone. This is human nature, things can happen. But if that happens, do not panic, just go to the doctor. And there are many other diseases besides HIV, which are 110% curable, even with a single injection. So these slides I'm showing you not to scare you and scare you also, both ways. You will see that how it can present. Now, so far I have told you that how it can be transmitted. I said sex, blood, and from mother to child. There is no fourth way. People have earlier used to have many misconceptions like, can mosquito bite lead on to this? Can we eat in the same thali? Can we use the same telephone? Can we share the bed? These things, by just simple hugging or kissing, the virus does not spread. As I said, how it spreads, you should also know how it does not spread. Then there were phases of this epidemic. There was a time before 1996 when we had nothing. We were only talking. We were delivering lectures. And whenever a patient came, we used to feel so helpless. Then one drug came, then the second drug, then the third drug. Today we have 26 various types of drugs of various groups which are available. We call them HART, highly active antiretroviral therapy. And in government hospitals, it is available free of cost. If you go to a private hospital, the cost is something like 1,200 to 3,000 rupees a month, which is not a big deal for many people, but it is a big deal for many other people also. So, but earlier, we used to say 4 tablets every 6 hourly. I remember I went to San Francisco, and we were traveling in a bus, and every few minutes there was an alarm by someone or the other, because San Francisco was the city where the HIV spread started first and was very fast also. And in those days, people used to put alarms to their mobiles for taking the pill, because the pill used to be every 6 hours. So you have to remember that, and you cannot miss, today I'm sleeping, I will not take it. No way. So that was the time when high pill burden, and it is to be taken with food and this and that. But nowadays it is very simple, just 1 tablet a day, which is a combination of 2 or 3 drugs. And even injections are now in the offing, which is given every month or 2 months. But they are not available in India. They will be available soon, injections. Other drugs are available, and the cost I have told you. But that, again, I say, does not mean that you can be relaxed. You have to take precautions. You must take precautions. That is important. And we have many challenges ahead. I said in the beginning, we want to reduce the number of infections, and that can come. Now, coming back to what Kalyan quoted in the beginning, let us not be killed by ignorance. This is an effort here to make you knowledgeable. And the second part I said was, use that knowledge. Maximum number of smokers are TB and chest specialists. Maximum alcoholics are those who know what are the side effects of alcohol. What is the point of having such knowledge? The point is you have the knowledge and use it. So I believe that once you have this knowledge, you will use it, Then only things will occur. And the other thing is access to the care. It is not only the pill, one pill a day. What happens is, supposing somebody is HIV positive, is doing good on the HIV front, but he develops a pain in the abdomen, he develops a heart attack, he develops any other ailment where a surgery is to be done. Believe you me, guys, majority of the hospitals, majority of the doctors, on one pretext or the other, will refuse. Will tell you, get this test done, we don't have a facility, there are more expert people, go there, there's that, those things happen. And these you can only realize if, I don't know how many of you, and I don't wish also, in your family have somebody having this disease. But these are problems, and there are social stigmas attached. I can narrate you stories and stories and stories about that. So ignorance and apathy leads on to AIDS, yes. Now the challenges are not that. Initially we used to think that this guy who has been diagnosed HIV today will die in maybe 6 months, 1 year, 2 years. And that is why people were more scared. But these days what is happening is that it is not a question of life and death. It is a question is that how to live with the disease. Once you survive. I know many patients who initially were saying, sir, please save our lives, please save our lives. Once they were saved, then they were saying, sir, I want to get married. Sir, I want to have children. Right? So this is life. Person want to go ahead. Don't think of a young boy of 22, 23, 25, or a young girl. I know a girl, I will show you a slide soon. This girl was married, it was with the family consent, but somehow the boy, in Punjab, there is a craze. I don't know about the South. In Punjab, there is a craze to go abroad. So whenever they find a boy from abroad, they will try to marry the girl quickly so that she can go to Canada or US. Now, what happened was this girl was married to some guy like this who was having multiple relations and was having HIV as well. So in the process, what happened was she became widow very quick. By quick, I mean that at the age of 21, she was a widow already. Now, what next? She came to me, we were giving medicines, she survived, everything happened. But in the family, she was ostracized. Her utensils were separated, her clothes were separated. She was not allowed to mix with the nephews and nieces. Her brother was supporting her very nicely. What happened in that process was that she fell in love with one of the servants of his own brother, her own brother. And once that happened, can you imagine? Now this boy wanted to marry this girl. He came to me, I said, don't marry, you will get the disease. He said, no, I'm in love, I want to marry. What is wrong in it? Sex is not everything in life, I can marry. Okay, the guy married. And then the brother of this girl threw that guy out, and the economic strains were there. By that time, government has started giving antiretroviral drugs, the drugs to treat HIV. So what happened next was that I sent her to the government center, and she came back crying. I said, what happened? She said, sir, they were seeing me like, I have done some blunder, because she was wearing that chuda. In Punjab, there is a tradition that girls wear chuda after marriage, the red bangles, right? So she was wearing that, and she was HIV positive. Though ART center guys, they were not that human in their touch. So they started asking irrelevant questions. I mean, somebody is suffering from a disease. How does it matter how he or she gets it? You treat. As a doctor, your job is to treat and hold the hands rather than thinking that something wrong has been done. Anyways, years rolled down. Then this lady, that was a problem. Then this guy married, who was HIV negative. Now we see many couples now who are serodiscordant, we call it. One partner is positive, one partner is not positive. Now they want to have child now. Once they have a child, they want that the child should not be positive. The expectations. It is like this. In UP, they say, कि ungli pakad ke pauncha pakadna. First you want this and this and this, then your expectations keep on increasing. And why not? And why not? So HIV is good. The other thing is, I'm reminded of one advocate. He used to come to me. He became all right after a long journey of ailment and was taking pills regularly and was happy. He was an advocate. But one fine day, I used to call these patients if they used to miss their pills. So one month I called the family and the wife says, Doctor, he came from you the other day and then he committed suicide. Now, why he committed suicide? He left a note. He said, I am sick of taking a medicine every day. So it is not a question of survival. You have to live healthily, happily also. This is also important. So getting HIV these days, you may not worry. People may think कि mask नहीं पहना तो क्या हुआ, condom नहीं पहना तो क्या हुआ, but what will happen next is a very difficult thing. Of course, the doctors will not let you die, but that is not life also. We don't want our patients to commit suicides, not to marry, to be ostracized in the society. These are, I got an email, urgent. Somebody wrote to me that I am from Uttarakhand and belong to a very orthodox family. I am HIV positive for last 7 years on ART. My wife is HIV negative, has never done intercourse without condom. This is a real mail I'm reading, right? And can you please suggest, is there a way to conceive without getting her infected? So these are real possibilities. HIV can lead on to problems and problems. And then I am reminded of a boy, he was fighting for his life when I was called to see him. And I was told that please do not tell even your colleagues that this fellow is suffering from HIV. Okay. He survived that. A girl used to come to him. I didn't know who is she, but she used to come regularly, visit. Anyways, this guy survived. He's one of the richest families in Amritsar. Now, once he survived, one day, a doctor who referred him to me told me, Dr. Bharti, this guy is getting married. I said, what are you talking? Earlier he was saying, just save me, and now he's marrying. I called him. I said, I hear you're marrying. No, sir, no, sir. Mega, okay, no problem. If you get married, please let me know and let the girl talk to me. I will tell her that what are the problems. If she's ready even then it's fine. So, but one day I came to know that this guy has already married. Okay, fine. He met me in the, these people start boycotting you as a doctor. I remember one of the patients who was a classmate of my son who is in US, not in Bahrain, the other one. He got HIV somehow. He was a BTech, MBA from prestigious universities. And when he died, his family became close to me. How he got it is irrelevant to talk. His father especially called me and said, Dr. Bharti, I have a request to make. Please do not come to the cremation ground. Look at this. I mean, you don't want to fall into that trap. And what for? Just one mistake, one night. Few seconds of pleasure leading on to a misery for the life or to the cutting off of your life. So that is something important you should understand. That this boy I was talking about, then the guy, he married that girl without telling her that I am suffering from this. He kept on telling her that I suffered from a chronic ailment, which tells that I should not have sex without protection. Okay, fine. It went on for a year, but how long a girl can say that? Then the pressure, society pressure, have a child. He was keeping on lingering things, and then one day he got it tested again, and he was telling me, are there some ways? Let me tell you, let me break a good news. This boy is now having 2 kids, both HIV negative. The lady is still HIV negative, and people in the town think that Dr. Bharti has treated him fully, which is not a total truth, which is a partial truth. He's surviving, he's living nicely. But that should not give anybody an inkling that it's okay, I can have it. We can have fun. And then there are people like Dr. Bharti who can save our lives, and we can live like any other person. Not only that, the treatment can do this. See, you see a person, many times in the beginning of this epidemic, I used to say, my wife will come, a patient will come and she'll say, she's a non-medical. She'll say, isko HIV, main kaha, how do you know? Iske muh pe thodi likha hai. It's not written on anybody's face that he is suffering from what disease. But this, when this happens, and this happens because of treatment, what you are seeing in this slide, then a person can know that he's or she is suffering from HIV, which is again not a good thing. So coming back to this, that the earlier question of dying and death is the past. Patients have to cope up with the issues of social acceptance, coping with the side effects, coping with drug resistance. Sometimes the first line drugs fail and then costlier drugs are required. The cost can go up and up and up to the tune of that even crorpatis cannot afford. And then there are no drugs. And then there are comorbidities, like because of the drugs, some things can happen. And a person, it is not, if a young person gets HIV, when he ages, he gets heart diseases, diabetes, hypertension, all those things. And then the drugs for them can interact with the drugs given for HIV. So we have now new challenges. The answers are hidden in vaccine. Again, like COVID, we are talking about vaccine and we are pushing on to vaccine. But I always say vaccine for HIV is only to know, to have safe sex, to have safe motherhood, safe syringes, right? And the vaccine around corona is same way, is wearing a mask and keeping a distance. So how parallel these epidemics are, I don't know. And this is not a new debate. This is a debate which should be renewed. Kalyan, how long can I go on?
Sir, we have more 15 minutes of time. Then after that, we'll have 15 minutes of question answer session.
Okay, so I should. So what should we do? You know, your organizations, I'm talking about this. And good thing is that government is providing the drugs free of cost. What we can do is we can make the government serve the people more. And it is the time to accept the challenge. And if we do not accept the challenge, what will happen? We all know that the price of inaction is death. The price of inaction is death. But life is in your hands. And those of you sitting here think, you know, as long as somebody has corona in his family, he thinks it cannot happen to us. Similarly, as long as somebody has known, I don't know all who are listening to this talk, how many of you have seen a HIV patient. But those who have seen can understand that what it is. It is a very difficult thing. And believe me, they are here, there, and everywhere. Longevity with the help of drugs is possible. Life will not be endangered, but the quality of life will not be the same once you get HIV, even if you survive HIV. So it is better that you follow those principles. Any sex which is unreligious, unprotected, or unnatural should be avoided. Do not get tempted. Many a times I know I can tell you stories where a person thinks that she's my college mate, she's faithful to me. I always say a few things that anybody can vouch for himself only. Nobody can vouch for any other person, howsoever close. Remember this whenever you want to. And if a need occurs, if circumstances are such that you have to have a physical relationship, then use a protection. I'm not a saint who will say that don't do this, don't do that. Do whatever, but make it sure that you do not fall into any problem at a later stage. This is number one. Number two, safe syringes. When I say safe syringes means doubt every doctor, doubt every laboratory, doubt every hospital. This I'm saying maybe, you know, to cause a rebellion against my own community, but then that is a fact. And things happen there. In my city, a nephrologist was fined to the tune of a life imprisonment of 3 years and some money. because she forgot to get HIV tested on a patient of renal transplant. I mean, things like this can happen. We are all humans. Doctors are not super gods. So don't believe them. And let me tell you one more thing. I used to tell in very early days of this pandemic that if somebody says 1 unit of blood is required before any surgery or anything, don't believe. 1 unit of blood cannot save anybody's life. It is better if it is not an emergency, if it is a planned surgery and a doctor says 1 unit, so nothing doing, build up the patient first, we'll get the surgery done later. If it is an emergency, then donate yourself. Get yourself tested and donate. I remember when my mother was admitted in a CMC hospital, and this I am talking of 92, not of today. I was a doctor. Even then, the doctor said, I wanted to donate blood. They said, we'll test you for HIV. 92. 2020 is a different story altogether. So in case blood is required, and when you go, you are young guys, when you go to barbers, saloons, even if the sophisticated saloons, you go for tattoo, you visit Goa, you go to Bangkok, to massage parlors, you go for ear piercing. These days, you know, people are putting up those studs everywhere on the tongue, in the lip, wherever. Be careful. It is your right, if you are paying, to know. Even if you are not paying, even if it is a government hospital, you are paying indirectly to them. It is your right to make sure that safe instruments are used, the safe syringes are used. That is important. And even minor things can lead on to. These days, there is a fashion of microblading. The girls know the microblading, they make the eyebrows. There is a fashion of PRP for hair growth. Wherever a needle is used, wherever there is a chance of a blood emission, be careful. And God forbid, if you know somebody who is HIV positive and is about to deliver a child, guide the lady that they should go to a doctor, and under the doctor's supervision, the antenatal period, that means before the delivery, the natal period, during the delivery, and after the delivery, the care should be taken so that the child, the new life, can also be saved from suffering from this disease. I think with that, Kalyan, I can stop sharing my screen.
Yes, sir.
Okay. And now I'm ready to face whatever questions.
Yeah, friends. So if anybody of you have any queries or questions, you can just unmute yourself and speak to doctor directly.
And if there are no questions, then I think probably people know everything. It was a waste of time. I don't know. But my message will be crystal clear that please go back home and tell these messages that this is how you can prevent yourself. I didn't dealt with the medicines part of it, because there is no point. None of you is a medical graduate. Otherwise, it would have been a long story. Even the tests, there are various tests and they have their fallacies. So one should be careful in interpreting the test. I told you during my talk that don't jump to conclusions. Even if you see, I remember last week a boy came and he had this story I left in between. He was found to have HSV, which is herpes simplex virus. On the roadside, he read the report and started crying. Hey, can you imagine a 30-year-old man crying on the roadside? Why are you crying? Because he searched on the Google that herpes simplex virus cannot go out of the body. That is the second enemy of ours these days. That little knowledge is also dangerous. Please, if you have anything, do not Google everything. And if you use Google, then use a learned friend on that field along with. That will help you. I will not say don't Google, don't surf. Knowledge is your right. But then use it judiciously. Do seek the help. Like it is, if I have a management issue and if I Google something, I cannot solve it myself. I have to ask people like Muskan or Tanya or Kalyan or Madam Madhuri, right? Madhavi. Madam Madhavi ji,
Yes, sir.
I couldn't see you.
Sir, I think Madam was busy with a different work, so
Okay.
I think she left somewhere in between the meeting.
So,
Yes.
sir, this is Naren. I have one question. The
Yes.
common question, like I usually do blood donation like voluntary basis. Nearby have two hospitals on Miyot and Ramachandra, so I go and do that. Is that like some doctors like advice? I just going through YouTube videos only. So in that, some doctors do telling volunteer blood donation is good, and some people do telling that organization hospitals is doing for some like revenue generation purpose. So it's a general question I want to is doing a blood donation on voluntary basis is good or only if it's a required and emerging cases we have to do, sir?
No. Blood donation is very important. And, many people die because of lack of blood. And blood, these days is not given as a whole blood transfusion. The various components are used. This is number one. Only important thing to know about this is in blood transfusion that go to the only authorized blood banks. What is happening is that anybody, number one, anybody can open a nursing home here. He may be a MBBS, BAMS, RMP, whatever. And if in case of emergency, they will bleed you. They may not be good. Because all authorized blood banks by the decision of the Supreme Court are bound by certain guidelines. So you must donate, but go to authorized blood banks. That is simple as that. They should have a license. Otherwise, it is a wonderful thing. Sri Lanka is a country where the eye donations are maximum. Eye donation, you can make somebody see through your eyes here after that. In India, it is not there. Same is true for blood donation. We are lacking much behind many countries. We must. It is an appreciable, commendable job you are doing, dear. You must do it, but make sure that you are doing it at the authorized center, and even at the authorized center, make sure that they are using a new set to bleed you, right? This is important. They should not use a used set.
Okay, sir.
There is a question here. I can see that how much family and human belief is important during the disease. I feel like telling you a story. I have been all along talking about Corona and HIV. My own brother's wife suffered from Corona, although she was not tested, but her oxygen level went down to 62%. Those of you can understand anything below 90 is dangerous, below 80 is very, very dangerous. 62 is life-threatening. So her oxygen level was 62. And she's obese, she's hypertensive, she's diabetic. These are all minus points. Those of you know a little bit about COVID know that in the presence of these things, the chances of dying are more. So I told my brother who lives some 80 kilometers from my hometown that please take her to the hospital, admit her. He told me that if I admit her, they will quarantine her and will not let any family member meet. And this sister-in-law of mine is very emotionally labile. He said that she will die of aloofment rather than Corona. So in the process, what he did was I sent him the instructions that what is to be done, how oxygen is to be monitored, how he can give at home and what medicines are required. And she survived. She survived because this question I am answering this, how much family and human belief is important. She survived because of the emotional support of the family and the belief that she will not die. And the belief of the family that even with going to the hospital, same is true for HIV. Hand holding is very, very important. I narrated one instance where an advocate who was doing very good, when he came, he had a 6-inch big wound, which was not healing at all. And then he survived and then he committed suicide. Then there is one Akshita Mathur. Oh, is that okay with your question about blood transfusion? Should I go to
Sir.
Okay, now coming to Akshita. Akshita says, can HIV spread through tumors? Let me tell you, we have a very famous saloon in Amritsar. I went there and he did not change the blade. I said, why? Why not? You're charging me 500 rupees for a haircut and you are not changing a 5 rupee blade? Why? Yes, they can if they have been used immediately on a patient. So you must make sure that they change the blades or it is sterilized properly. I would rather suggest that if you want, Akshita, then take your own. Then is that okay, Akshita? Are you okay? Satisfied?
Yes, sir. Thank you, sir.
Okay. Then there is Saranya.
डीन लोग हैं, प्रिंसिपल लोग.
She wants to know how long does it take for HIV symptoms to appear? Oh, it's a very, very difficult question. It is like this, the immunity of every person. I always tell people that HIV, the virus, is like termite in the wood. Like if this wood door gets termite infection, it will not fall in one day. It will take long years. Similarly, with HIV in your body, what it does, it multiplies and multiplies and multiplies and kills your immunity till a day when your immunity becomes zero. So if your immunity is already zero, then you will die soon and you will have symptoms soon. But if your immunity is good, then symptoms may take a long time. I have seen patients who had no symptoms for 10 years. Nothing happened. I know patients who developed symptoms in less than 3 months' time. So it varies on the quantum, how much HIV load has gone into it. Now, the maximum load goes immediately with blood transfusion, not through sex. Sex also, from men to women, women to men, the ratios, percentages differ. But blood transfusion, if somebody who is HIV positive, his blood is transfused, instant transmission of the virus and symptoms appear fast. Otherwise, symptoms may take years even, or months. But we say 3 months is the window period. In those 3 months, even the test can be negative. That is why we always say, if you test today, you have to repeat the test after 3 months minimum. And once the test is negative after 3 months also, then you have escaped the clutches. Any more questions?
Yes, sir. I have a question.
Yes, please.
Yeah, sir. So, like in India now, people have started, taking into consideration about donating their organs. So, my question was that people who have, recovered from HIV, can they donate their organs, or is it like they can never do it, even after recovery?
That is a very, very beautiful question, wonderful question, Tanya. And let me tell you that they can donate certain organs, like they can donate cornea, right? But other organs, if their HIV viral load, because with the drugs, what happens is HIV viral load becomes negligible. By negligible, when I say, it means that the virus, 1 or 2 viruses sitting hidden somewhere in the body. That is why we say nobody becomes negative, but everything is under control. His CD4, we call it CD4, which tells the immunity of a person. I did talk those technical things, but CD4 is good and viral load is negative, not detectable. Then cornea can be given because cornea doesn't have blood. This is one thing, eye donation, right? Now, regarding the other organs, it will depend on the health of those organs also and the health of the person also. Preferably not. But eye donation, to my mind, yes. Blood donation, a complete no.
Okay, thank you, sir. And sir,
Welcome.
another question I have. So, like when we go for normal checkups, like any blood test at any of the testing centers, so there do we have any risk? Because like in front of
Of
us, they
course,
use new injections and everything, but
of
still.
course, that is what I said. You have to make sure that they change the needle. It is the needle which pierces you, right? And if on the needle, it is theoretical risk, but the risk persists. It is not that 100% of the times. Supposing some HIV patient, they have taken a blood sample and immediately that needle is used on you. Yes, you are in trouble. So you have to be careful. I mean, it makes no sense. Why should they not change the needle? Gone are the days when used to boil. That was a better way, if you ask me. But anyways, because in disposables also there is a lot of scandals, they are repackaged, resold.
Yes, about
That is
that only.
during
Because
the
of
job
that only I asked.
country of cheats. We want to earn money on anything. But yes, we should be careful. That's what I said, that wherever there is a chance of blood, you should be careful. Tattoo, ear piercing, not wherever you put, nose.
Thank you, sir.
Sir,
Thank you, sir.
in
Sir,
that
I have.
case,
Yes, yes, Akshay.
yeah, so in that case, the donating a blood will be a risk only, right? Always in India.
No, 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 no.
No, actually, sir, what is
Go
happening?
with the idea. See, if you go to an unauthorized blood bank, and if
Okay.
you are not a little careful, then there is a risk. You
Okay,
know, I have seen thousands of HIV patients, and I tried to find out the mode of transmission. Let me tell you, Akshay, that in 10% of the patient, I could not find any cause. Despite, nowadays, I don't dig much into the history. We call it history, medical history. But earlier we used to. And I tried to find cause, and in 10% of the patients, I could not, which I believe was probably the injection syringes or the barbers or whatever. But blood donation, to my mind, throughout this period, I have seen only 1 or 2 patients out of thousands I have seen. And those were the patients who went to unauthorized blood banks. So go to an authorized blood bank.
so,
And I tell you, there
actually,
is a, please.
my concern was asking to this. There is a thalassemia patient in my nearby relative. So regularly, I am donating a blood for them. So now I am just bit worried about that whether I should continue that or what. So
You
that
must
is why I
continue.
asked.
You must continue, but make sure that the set which they use to bleed you is the fresh one. That's it. That's it. No, nothing to be scared. And you are doing a wonderful job. You're saving that life. I know thalassemia patients is very difficult to get transfusion that frequently. And to find a donor, if you back out, what will happen to the person? No,
Yes,
no, don't back
yes,
out
it
after I
becomes
talk.
very difficult for them.
I know. Good question in any case.
Sir, this is Pawan, sir. I have a doubt, sir. Can HIV also leads into the cancer, sir?
Pavan, wow. Very nice, very nice. You know what HIV does? I said that it reduces your immunity. Now, what happens in the process is that there are some opportunistic people. I should not say people, ways. Opportunistic infections like deep fungal infections, which can attack a person who has HIV not under control. Similarly, cancers can occur in HIV patients whose immunity is not. See, these days we don't see so many things because the dictum now is that we start treating the patient as early as possible. The moment we come to know that somebody is HIV positive, we start the treatment. So the chances of immunity going down are much less. What these drugs do is they not only kill the virus, they also increase the immunity. Okay, or they save the immunity. So yes, earlier we used to say opportunistic infections and opportunistic cancers are more in HIV patients, but these days we do not see so much. Of course, non-Hodgkin lymphoma is commonly seen. I have seen few patients. I have seen basal cell carcinoma, which is a type of a carcinoma on the skin. I've seen many other malignancies, but that was in 90s. Now I
Yes,
don't
sir.
see.
Basically, and the cervical cancer is also called as like an AIDS cancer only, sir.
Cervical cancer is, yeah, you touched a very important thing. Cervical cancer is usually associated with what? Usually people say those girls who have, not breastfed their children or are not unmarried, they get more chances of getting cervical cancer. And cervical cancer can also be easily detected after the age. Like in men, the cancer prostate is very common. Similarly, in females, there are 2 cancers which are very common. One is cancer breast and one is cancer cervix or cancer uterus also. So they can, after the age of 50, there should be a regular annual checkup for that. That goes true for HIV population also. That is why I said living with HIV doesn't mean that you can't have other things. And once you have other things, you have to take care of them. And the problem if a cancer occurs to a HIV person is that doctor has to see that the drugs given for HIV and drugs given for treating cancer do not interact with each other and do not create more problems, then solve problems. I think that can satisfy you, Pavan.
Yes, sir. Thank you, sir.
Welcome. Any other? Tanya, I hope your selection was okay.
Sir, it was wonderful to have you, sir. And like it was a great learning session. And thank you so much for, taking out time from a busy schedule and then giving us time. I'm so sorry for the background noise here. So yeah, thank you so much, sir.
Yeah, friends, any more questions? Okay, sir, shall we end the session? Like, can we come to the yeah.
All up to you.
Yes, sir. So, Muskan, please go on.
Thank you. Thank you, sir, for such enlightening answers. We are sure all of us have gained some new perspectives and are taking something back with us. On behalf of Club Sankalp and MWB, we are grateful for you and for you to take out some time out of your calendar and joining us here. We want to present a token of appreciation for you. Kalyan will present it, yeah.
Thank you so much.
We will also mail it to you, sir.
Thank you.
We would also like to thank JSK Chakravarti sir and Madhvi ma'am for giving us this wonderful opportunity to host this guest lecture on ending the HIV/AIDS epidemic awareness and prevention. We would like to express our gratitude to our promotional partner, IBS Messenger, and our editorial partner, Newswire. Last but not the least, we would like to thank the participants for their patience and active participation. Thank you, everyone. Signing off, Muskan.
Thank you all. Signing off, Kalyan.
Muskan.
Thank you, sir. We had a great session with you.
Thank you.
I think, yes, sir. I think we will again come back to you if we need anything, any help from us or whatever it is.
I think I forgot to give my email and telephone number. You can display later on.
Yes,
and
sir.
Anybody who wants to approach me through WhatsApp, through mail is most welcome.
Yes, sir. Yes, sir. We will definitely do that. Thank you so much, sir. Thank you.
Thank you.